Nearly 50% of female cyclists report long-term genital swelling or like actual physical disfigurement from their sport.
Yeah, it's a staggering statistic when you actually
Yeah.
look at it on paper.
Right. And up to 80% experience vulvodynia, which is this chronic, just debilitating vulvar pain. So if you are someone who's always looking for that aha moment hidden in complex research, today we're tackling a massive unspoken crisis in women's sports.
We really are. I mean, we are talking about a fundamental breakdown of human tissue caused directly by sporting equipment.
Right.
And it's an issue that has historically just been ignored or, simply accepted as the cost of doing business for female athletes.
Exactly. So our mission for this deep dive is to explore the exact efficacy of a cutting-edge regenerative therapy. It's called polynucleotides, or PNs, and we're looking at how it treats chronic friction-induced vulvar dermatoses in active female athletes.
Right, and it is quite a journey.
Oh, for sure. We're going to go from the absolute biomechanical nightmare of what's known as cyclist's vulva through the complete failure of traditional treatments, all the way down to the molecular science of using, get this, highly purified marine DNA to rebuild mechanically destroyed skin.
It sounds like sci-fi, but it's very real.
Oh.
But to truly grasp how a regenerative therapy like polynucleotides can heal this tissue, we first really need to look at the biomechanics of how the athletic environment is dismantling it in the first place.
Yeah, let's start there, because the anatomy itself plays a huge role, right?
Absolutely. The anatomy of the vulva creates a highly specific set of vulnerabilities when you introduce it to endurance sports. Like the mons pubis and the labia majora are naturally rich in adipose tissue, hair follicles, and a really high concentration of sweat glands.
We're talking about what, sebaceous glands?
Yep, sebaceous glands that produce oils, and then your apocrine and icrine glands that produce sweat.
So you essentially have an area that is designed to be naturally moist, warm, and highly permeable.
Exactly. Now add intense mechanical friction, trapped moisture, and really high heat from, tight lycra and hours of aggressive pedaling.
It's a recipe for disaster.
It completely destabilizes the microenvironment. The vulva relies on a very delicate microbial community, primarily strains like lactobacilli, to maintain an acidic pH. And that acidic pH is what keeps harmful bacteria out.
Right.
But the heat and the friction, they just throw those lactobacilli and Staphylococcus populations entirely out of balance.
It honestly sounds like taking a delicate, finely tuned rainforest ecosystem, sealing it inside a high-heat, high-friction vice grip, and then, wondering why the native flora starts dying off and the soil just starts to erode.
That is a perfect analogy. And the erosion is both biological and physical. I mean, the vice grip analogy is incredibly literal when you factor in the mechanical pressure of the bicycle saddle itself.
Oh, the saddle. Yeah, this is where it gets really crazy.
Right, because all of the rider's upper body weight is concentrated on this very small, incredibly sensitive surface area. And this physically compresses the pudendal nerve, which is the main nerve serving the pelvic floor, and it collapses the surrounding blood vessels.
And whenever you collapse blood vessels for extended periods, you trigger ischemia, right? Meaning the tissue is literally being starved of oxygen and vital nutrients.
Exactly. And ischemia over long durations leads to severe neuropathy. I mean, 58% of female cyclists report experiencing genital numbness.
58%. Wow.
The neurovascular bundle of the vulva is totally compromised, and that leads to chronic pain and decreased sensation that radiates out. It severely impacts a woman's sexual health and just her daily life, even when she's nowhere near a bicycle.
Which is just awful. And I know a lot of riders try to solve this mechanical pressure by switching gear. Like, a lot of women opt for those cutout saddles, the ones with the hollow channel down the middle.
Oh, right, thinking it will relieve the pressure.
Exactly. But the research indicates that specific design is actively making the problem worse for women.
It is. The history behind cutout saddles, it perfectly illustrates the danger of applying male-centric ergonomics to female physiology.
This part blew my mind.
Right. Those hollowed-out saddles were originally designed following research by the CDC.
Right.
And they were trying to help male police officers who were experiencing erectile dysfunction from long hours on bike patrols.
Wait, male police officers?
Yes. The cutout was engineered specifically to alleviate pressure on male vascular anatomy.
So, which means when a woman sits on that exact same saddle, her anatomy is interacting with a hollow trench it was just never designed for.
Precisely. The biomechanics completely flip.
Yeah.
For a woman, the cutout actually increases the localized pressure along the hard, rigid edges of that hollow space.
Oh, ouch.
Yeah, instead of relieving tension, gravity, and the downward force of pedaling, force the labial tissue to swell directly down into the cutout.
Oh man, so delicate inflamed tissue is essentially being pushed into a hard trench.
Exactly. Dramatically exacerbates the swelling, the friction, and the nerve damage.
And if the labial tissue is swelling into that rigid trench while the legs are constantly pumping, we have to be moving beyond just a superficial rash. The sheer mechanical force must be tearing the tissue apart at a microscopic level.
It is. The sources outline a very severe progression of cellular breakdown. It starts with severe erythema, which is, intense, widespread redness and inflammation,
Right.
and then it progresses to vulvar contact dermatitis. But if the friction continues unchecked, athletes develop conditions like lichen simplex chronicus.
Okay, I really want to pause on lichen simplex chronicus because the reality of what that means for an athlete is shocking.
It is brutal.
Yeah.
When skin is subjected to chronic, relentless mechanical trauma and rubbing, its ultimate defensive response is to alter its own structure.
It tries to protect itself.
Exactly. It thickens and becomes leathery. This process is called lichenification. The skin becomes rigid, fibrous, and it loses all of its natural elasticity.
So it basically turns into leather.
Yes. So everyday activities like sitting down, walking, and certainly intercourse become incredibly painful because the tissue can no longer stretch. It just tears.
God, how does the skin get to that point of total structural failure?
Well, a major factor driving this destruction is a dermatological metric known as transepidermal water loss, or TEWL.
TEWL.
Right.
Okay.
So the stratum corneum is the outermost layer of your epidermis. You can think of it as functioning like a brick-and-mortar wall that keeps moisture inside the body and environmental irritants out.
Okay. Makes sense.
But the constant friction physically shears away those top layers. The wall is totally compromised. And once that barrier breaks, the tissue can no longer hold on to its internal water.
So all the vital hydration simply evaporates out of the compromised skin?
Exactly. The tissue becomes severely dehydrated and brittle, which of course makes it even more susceptible to micro tears and invasive bacteria.
It's a vicious cycle.
A terrible one. The TEWL skyrockets, and the skin enters this relentless cycle of dehydration and inflammatory breakdown.
Okay, so if the skin barrier is literally breaking down and leaking water, the traditional advice given to female athletes suddenly seems wildly counterproductive. I mean, riders are often told to just tough it out or, wait for callus to form or slather the area in petroleum jelly or heavy chamois creams.
Yeah, applying petroleum jelly to a structurally collapsing epithelial barrier, it introduces a whole host of new problems.
Because it's an occlusive, right?
Right. Petroleum jelly is an occlusive agent, so it sits heavily on top of the skin and completely blocks the pores. It traps the ambient heat generated by the exercise, creating this perfect incubator for bacterial overgrowth.
Gross.
And furthermore, petroleum-based products physically degrade the synthetic foam padding inside modern cycling shorts.
Wait, really?
Yeah, it destroys the very cushioning that's meant to protect the rider in the first place.
Plus, just getting an occlusive, heavy oil out of your skin after a long ride requires intense scrubbing. The sources point out that athletes end up using harsh alcohol-based astringents or heavy soaps just to feel clean.
Which is the worst thing you can do. Introducing harsh astringents to an already compromised vulvar environment is devastating. You strip away whatever protective lactobacilli managed to actually survive the ride.
And without that acidic barrier, the risk of developing yeast infections and bacterial vaginosis just skyrockets.
Absolutely. And it's not just petroleum jelly. Many commercial chamois creams contain ingredients like cetyl alcohol, which actively pull moisture out of the skin.
So an athlete uses a cream to reduce friction for a few hours.
But the chemical composition excessively dries out their already dehydrated tissue, so it leads to more severe micro tears on the very next ride.
Wow. So we've established that the biological wall is collapsing, and putting a slippery occlusive Band-Aid over the cracks is only trapping heat and breeding bacteria.
Exactly.
Which brings us to the core of our deep dive. How to actually rebuild the cellular wall. The research points to a treatment utilizing polynucleotides, or PNs, but I really have to push back here.
Okay, go for it.
The jump from chafing creams to applying marine DNA derived from salmon and trout, it feels like a massive leap. Are we, genetically modifying human skin with fish DNA?
That is the most common misconception regarding polynucleotide therapies, and it is so vital to understand the purification process. You are not introducing active genetic code that will alter your human DNA.
Okay, true.
The manufacturing process extracts the DNA from marine sources and then subjects it to ultrapurification. This strips away all of the biologically active proteins, peptides, and any immune-triggering components.
So what's actually left?
What you're left with is a highly concentrated pool of the fundamental building blocks of life, the nitrogen bases and nucleosides.
So we are just taking the raw, inert construction materials of DNA and applying them to the damaged skin.
Exactly.
But how does a topical application of raw nucleotides actually fix a mechanical problem like friction?
Well, PNs operate as what we call bioactive scaffolds. If you examine a highly concentrated polynucleotide gel under a scanning electron microscope, it doesn't look like a disorganized puddle of liquid.
What does it look like?
The long-chain polymers cross-link to form a highly ordered, three-dimensional matrix. It actually forms a tessellated polyhedron structure, interlocking shapes that look very much like a microscopic geodesic dome.
Oh, wow. Like architectural scaffolding.
Wow.
Interlocking pentagons and hexagons.
Exactly like that. And when you apply this to the compromised dermis, that 3D matrix physically integrates into the extracellular space.
Yeah, right.
It acts as a literal shock absorber. It provides immediate physical support to the damaged tissue and actively redistributes the mechanical tension and those shear forces across a much wider area of the skin.
That's incredible. It's literally propping up the collapsing tissue from the inside out while it repairs.
Yes, it is.
But earlier you mentioned transepidermal water loss, TEWL, was a major factor in the skin breaking down. How does this scaffolding address the severe dehydration?
Right. So polynucleotides are incredibly hydrophilic, meaning their chemical structure acts as a powerful magnet for water molecules.
So they draw moisture in.
Exactly. They bind and hold massive amounts of hydration within that geodesic structure. And because they're dense long-chain polymers, they are highly resistant to enzymatic degradation.
Meaning the body doesn't just metabolize them and wash them away in a few hours.
Right. They anchor into the tissue, providing deep, sustained hydration to the exact areas where the barrier has failed.
I mean, I can visualize how a water-binding biological scaffold helps soothe the area, but how do we know it actually holds up against the extreme, repeated mechanical stress of an athlete's dermatosis?
Clinical dermatology tests this through a pretty brutal but effective methodology known as tape stripping.
Tape stripping. That sounds awful.
It's not pleasant. Researchers apply a specialized adhesive tape to the skin and aggressively rip it off over and over.
Yikes.
Yeah. This process uniformly tears away the stratum corneum, perfectly mimicking the severe friction, mechanical disruption, and barrier failure a cyclist experiences over hundreds of miles.
It sounds agonizing, but I guess it's a highly accurate way to simulate the exact trauma we're talking about.
It is. And once the skin was mechanically destroyed in these models, researchers applied a treatment combining polynucleotides and hyaluronic acid.
Ian, what happened?
The results on transepidermal water loss were profound. In the control group with the destroyed barrier, TEWL hovered around 43 grams per square meter per hour.
Okay, so losing a lot of water.
Right. But in the group treated with the PN scaffold, that water loss dropped down to approximately 20 grams per square meter per hour.
Wow, that's less than half.
Yes. The structural integrity of the skin barrier was essentially restored to normal function.
So the moisture wasn't just temporarily trapped, the wall was actually rebuilt. And the research highlighted that PNs achieved this by fundamentally changing the protein expression in the skin, right? Specifically targeting a protein called filigrin.
Yes, filigrin. Filigrin is really the unsung hero of skin barrier function. You can think of it as the vital mortar that binds the structural keratin bricks of your skin together.
Mortar for the bricks, got it.
But in a state of chronic inflammation, the body's own defense mechanisms inadvertently destroy filigrin, causing the skin to become really fragile and permeable.
Ah.
Clinical biopsies show that treating the tissue with polynucleotides significantly upregulates the production of filigrin. The scaffolding allows the skin to start producing its own mortar again.
So we are seeing a dual action mechanism here. The PNs provide an immediate physical structure to protect the area while actively commanding the skin's own biological factories to start producing the proteins necessary for long-term repair.
It really is dual action. And the communication happening at the cellular level is just fascinating. PNs act as molecular modulators within the inflammatory cascade.
Meaning they talk to the immune system.
Basically, yeah.
Yeah.
When tissue is constantly crushed and sheared, the immune system panics and it floods the area with inflammatory cytokines, specifically TNF-alpha and IFN-gamma.
Okay.
These act as blaring alarm signals telling the body it is under severe attack.
And a body under attack doesn't focus on rebuilding, right? It focuses on defense, which leads to that thick, leathery lichenification we discussed earlier.
Exactly. And this panicked state also triggers the overproduction of matrix metalloproteinases, or MMPs.
Yeah, MMPs.
Right. MMPs are enzymes that function like a demolition crew.
Hmm.
Their normal job is to break down damaged tissue so it can be cleared away.
Which makes sense normally.
Right. But in a state of chronic inflammation, the demolition crew goes into overdrive. They literally start chewing up and degrading the healthy collagen and elastin in the vulvar tissue.
Oh, that's horrible. How do the polynucleotides intervene in that chaotic environment?
They silence the alarms and halt the demolition.
Really?
Yeah. PNs downregulate the expression of those alarm cytokines, TNF-alpha and IFN-gamma, and they actively suppress the MMP demolition enzymes. They also reduce the infiltration of neutrophils, which are the aggressive white blood cells that cause all the swelling and redness. By modulating this whole cascade, the PNs command the tissue to shift out of a state of chronic defense and back into a state of active regeneration.
Okay, but if the demolition crew is fired, who does the rebuilding?
The fibroblasts. Fibroblasts are the cellular factories in your skin responsible for pumping out fresh collagen and elastin.
But factories need raw materials.
Exactly. And as the polynucleotide scaffold slowly breaks down over time, it passively feeds those purified nitrogen bases directly to the fibroblasts. The factories use those nucleosides to synthesize new, healthy tissue at an accelerated rate.
That is just wild. We are looking at a therapy that stops the destruction, provides a temporary structural bridge, and hands the body the exact genetic building blocks it needs to repair the damage.
It's elegant, really.
It is. So how is this actually being applied in the real world outside of a laboratory?
Well, these are highly regulated treatments, classified as Class 3 medical devices. We are not talking about over-the-counter cosmetic lotions here.
Right, you can't just pick this up at the drugstore.
No, they are rigorously tested clinical therapies delivered through specialized gels, topical creams, or intravaginal ovules. And they frequently combine the PNs with hyaluronic acid to maximize that hydrophilic water binding effect we talked about.
And the clinical observations on these medical devices showed some pretty staggering success rates for severe vulvovaginal damage, didn't they?
They did. The data reflects therapies used on patients suffering from vulvovaginal atrophy, lichen sclerosis, and severe contact dermatitis.
Very severe conditions.
Exactly. And in clinical settings, over 60% of the women treated reported massive relief from burning, severe dryness, and dyspareunia, which is painful intercourse within just 2 weeks of application.
2 weeks.
2 weeks to reverse symptoms that many of these women had endured for years.
It really paints a clear picture of how starved the tissue was for those foundational regenerative elements.
It does. And the regenerative capacity extends far beyond athletic chafing. Because PNs replenish the nucleotide pool, they are showing incredible efficacy in reversing tissue atrophy caused by systemic trauma, too.
Like what kind of trauma?
This includes women recovering from chemoradiotherapy, or navigating the sharp estrogen drops associated with menopause, or even dealing with localized vaginal atrophy caused by certain oral contraceptives.
Okay, I have to challenge this a bit when we talk about the limits of regeneration.
Fair enough.
I can completely understand a biological scaffold healing a severe rash or restoring moisture to atrophied skin. But for an athlete who has spent, say, 10 years in the saddle and has already developed that thick, leathery, lichenified skin, is it too late? Can a topical DNA gel really remodel chronic, hardened scar tissue back into healthy, elastic mucosa?
It's a great question, but the data on scar remodeling is actually highly optimistic. Yeah. Because polynucleotides actively stimulate fibroblast activity to lay down new organized collagen, while simultaneously suppressing the enzymes that cause rigid fibrous scar formation. They gradually break down and remodel that thickened tissue.
So it essentially reverses the lichenification process over time.
It does. They also heavily reduce the local oxidative stress and hyperpigmentation that invariably accompany chronic friction scars.
That's amazing.
And this remodeling capability is crucial because the alternative for these athletes is grim. Without a biological scaffold to rebuild the cellular integrity, the permanent nerve damage and structural failure eventually require surgical intervention.
Right.
We see riders forced into labial reconstruction or plastic surgery just to regain normal, pain-free daily function.
Which is just heartbreaking. Because the baseline expectation for so long was simply to deal with the agony until you needed surgery or were forced to abandon the sport you love.
Right, but knowledge of regenerative cellular biology completely dismantles that expectation. Enduring tissue destruction should never be the hidden tax of being a female athlete.
I couldn't agree more. So, to bring all of this together for you, the efficacy of polynucleotides for friction-induced vulvar dermatoses lies in their unique ability to form a hydrophilic structural DNA scaffold.
Exactly.
This marine-derived matrix physically repairs mechanically destroyed skin barriers, drastically boosts the production of structural proteins like filigrin, and actively silences the chronic inflammatory cascade. By providing the exact nitrogen bases needed for cellular repair, PNs are literally saving female athletes from permanent nerve damage and forced surgical reconstruction.
Looking at sports medicine through this regenerative lens opens up a completely new paradigm.
Mm.
We move away from temporary, harmful band-aids to true, structural, biological solutions.
Absolutely. You should not have to sacrifice your sexual health, your comfort, or your body's structural integrity to ride a bike. Understanding that highly advanced regenerative tools like polynucleotides exist empowers you to demand better care and real medical solutions from your providers.
Here, here.
I want to leave you with a final lingering thought to ponder long after this deep dive ends. Think about the opening image we explored, that delicate microbial ecosystem crushed in a high-friction vice grip, largely ignored by a culture that advised athletes to just apply petroleum jelly and tough it out.
Right.
If we now have the capability to use highly purified marine DNA to biologically restructure and heal mechanically destroyed tissue in the vulva, what other high-friction, high-impact areas of sports medicine are completely ignoring the immense potential of regenerative bioscaffolds simply because athletes have been culturally conditioned to accept the pain?